Research has shown exercise to be excellent for mental health, but you probably did not need research to tell you that. Yet, exercise is not typically implemented during inpatient mental health care. Instead, therapy under the guidance of a mental health professional, such as a psychologist, and medication is relied on. Therapy and medication have also been shown to be beneficial, but ignoring the value of exercise takes away from the whole picture. Through the use of an exercise program within inpatient mental health care, patients may be better cared for in a way that focuses on healthy lifestyle changes. Research into exercise has been very promising for how it can be applied to alleviate symptoms of and treat a multitude of different mental illnesses. Many even calmly advocate that it takes the gold medal for being the best remedy. One research study found that patients perceive inpatient exercise to be beneficial for them mentally and physically. It also found that the exercise motivated almost all of the patients to continue exercising. The research studied two groups. One composed of patients with mood disorders, such as depression, bipolar, and borderline personality disorder, and the other composed of patients diagnosed with cluster A mental illnesses from the DSM, such as schizophrenia and schizotypal personality disorder. For those with a mood disorder, these patients reported positive effects after the exercise. 93% said they were pleased with the way their body felt. 93.2% said they had improved their mood, and 97.6% thought they would exercise more in the future. For those with cluster A mental illnesses, similar results were discovered. 90.6% said they were pleased with the way their body felt. 96.8% said they had improved their mood, and 100% thought they would exercise more in the future. It is true that those who participated in the research's exercise program may have already been interested in doing further exercise, but the fact that the percentage of patients to do so is so high is hard to dismiss. Additionally, exercise has been shown to also physiologically improve mental health through biochemical changes. There are many examples to point to, but the role of tryptophan stands out. Exercise promotes tryptophan to turn into serotonin rather than kynurenine. This is good because serotonin has been linked to decrease the likelihood of depression, where kynurenine has been linked to causing depression. In other words, without exercise, the body will have a higher tendency to produce more depression-causing chemicals. How does therapy and medication compare to exercise for improving mental health? Exercise has been shown to be 150% better for mental health than either medication or cognitive behavioral therapy. Being that therapy and medication have their place in mental health care, exercise should not always be used as a total replacement. Where applicable, it should be used in conjunction with these methods to better and more quickly improve the mental health of patients. Yet the use of medication may sometimes not even be a necessary means of treatment. It can be argued that medicine is overprescribed and exercise should be the supported protocol for some. The CDC reported that between 2015 and 2018, 13.2% of adults in the US were taking antidepressants, while considering how another CDC report stated that only about 24% of adults in the US exercise on a regular basis. One can easily come to believe that exercise could substitute for the need for medical interventions. The more people there are who exercise, the less people there will be to have a mental illness. And for those who already have a mental illness, exercise may halt the need altogether for seeking or needing a pharmaceutical course of action. Exercise is a good alternative, in part, because it is free and has essentially no negative side effects. For example, when medicine is prescribed for depression, a person and their insurance company will have to pay for it. Once taken, this medicine often causes a blunting of emotions. It can not only prevent the lows of depression, but also prevent the highs associated with things that bring happiness. In one study, about 65% of people who took antidepressant medication long-term reported feeling emotionally numb. Where it can be a positive that a person will not be dragged down by negative feelings that tend to rise over their day-to-day. On the flip side, common things that bring joy, such as having a good social interaction, will not cause much of an uplifting, positively reinforcing emotion, if any. With the exception of any injuries that are run into, exercise is all beneficial. The body feels nice and the mind feels satisfied. Research has shown that medication may only be best used as a short-term solution for many, being that its effectiveness fades over time. A 2022 research paper found that for those living with depression, their quality of life was not improved if they took antidepressant drugs. This is not true for exercise. Exercise promotes positive feelings throughout one's life, so it can be used during any point of their life. With exercise being so beneficial towards one's mental health, it is interesting that it is not a staple of every inpatient mental health care program. Many of the common reasons why it is not more frequently implemented were outlined in a 2024 research study published in the International Journal of Mental Health Nursing that reviewed the research on this topic. This research narrowed these reasons down into 4 explanations: the patient's mental and physical health, care facilities, environmental, and cultural. Regarding the patient's mental and physical health, they often reported having a lack of motivation, energy, and confidence in their abilities. Further, they did not want to be in public. The care facilities stated that their staff was disinterested and felt that they were unqualified. The environmental factors relate to having an insufficient number of staff, not having the proper space or equipment, and lacking the funds to allocate towards physical activity. Culturally, it was the norm to focus on medication as the primary form of treatment, and exercise was deemed as just being too risky. All of these reasons seem more like excuses than reasons. Every one of them comes down to an unwillingness to just do the work. On the patient's end, of course they're going to lean away from it. That is what happens when somebody has a mental illness. They have been admitted into a mental health care program so they can improve their mental health. Therefore, it is the facility's responsibility to get them to change their habits so they can actually improve. This does not mean they can force them to exercise, but it is negligent of them to not provide them with the opportunity and encourage them to do so. As the aforementioned research on patients with mood disorders and cluster B mental illnesses alluded to, the very high rate of interest in continuing exercising after doing an exercise program shows that a little can go a long way. Just by exposing the patients to a little exercise, they begin to want more and seek to plan further time for exercise. On the facility's end, the reasoning is just a bunch of words without any real substance behind them. It is not as difficult to implement exercise into treatment as they are making it seem. They do not need large facilities with high-end equipment and highly trained physical trainers as if they are training the next weightlifting Olympic team. It can be as simple as doing some group activity to elevate the patient's heart rate for a short period of time every day. And interestingly enough, this requires zero extra space or funding. For instance, a research study found a significant improvement in well-being and mood after walking for just 20 minutes, which is about 1 mile, in a blue space. The improvements in this environment exhibited better results than walking in an urban area or just resting in an ordinary room. Additionally, the preference towards trying to medicate the problem away stems from laziness from both the patient and facility. They just want an easy, effortless fix, even though they likely know, especially the facilities, that this is not the right way to treat the patient. If they truly want to improve their mental health, they will have to put in the effort, rather than trying to chemically engineer their bodies through trial and error. The US has seen a trend in the rise of poor mental health. This indicates that something must be done to buck this trend so people can live a good life. Most of what mental health care programs can do is provide assistance once an issue has already manifested. They cannot necessarily prevent the issue from ever arising. Yet they have to do what they can. By improving their methods of care by implementing exercise, they will be playing their part. As the Kaiser Family Foundation pointed out, the American Academy of Pediatrics, American Academy of Child and Adolescent Psychiatry, and Children's Hospital Association, they all partnered in 2021 to declare a national state of emergency in children's mental health. Further, they called attention to CDC findings that 42% of children reported feelings of sadness and helplessness, which is a large increase from 29% in 2011. Backing this up, The U.S. Department of Health and Human Services published a study in JAMA showing that between 2016 and 2020, the rate of children between the ages of 3 to 17 being designated a diagnosis of anxiety increased 29% and depression 27%. Granted, this increase was exacerbated through the pandemic, the trend was still found prior to it. As for adults within the U.S., SAMHSA reported that the rate of mental illness rose from 17.7% in 2008 to 21% in 2020, which is about a 19% increase. Not only does exercise cause a physiological change on one's body to cause positive mental health improvements, it plays a positive role on one's psychology. This is because exercise is challenging and allows for goals to be set and accomplished. With all of this in mind, it should come as a surprise that exercise is not a more common practice for inpatient mental health care. In conclusion, I recommend that the standard of care should be reformed to include exercise. In the future, I hope to see these updates be made as these care programs begin to become more in line with a holistic approach that puts lifestyle changes at the forefront. As always, please remember to like this video, subscribe to the channel, and comment. This is the Agency of Influence.